day. This is Maylene and I am from BSN 2A11 of Southwestern University, FINA. And today I am going to demonstrate on how to insert the catheter for the female patient. And before inserting the catheter, we have to verify first the order and then prepare all the materials needed. So we have here the catheter, the 10cc syringe, the urine bag, as if that this is the lubricant sterile. We have here the iodine, the alcohol, the sterile gloves, and also we have here the forceps and the washing cloth, the kidney basin. We have here the underpad, and then the fenestrated rate, and also the sodium chloride. And also, after preparing all the materials needed, we have to identify first the patient by asking their name or find their name through the wristband, and explain the procedure and ask for iodine allergies. And then we have to ensure our patient's privacy and good lighting, and position the patient correctly, assist the dorsal recumbent position, so as if that we've assist the patient into dorsal recumbent position with knees flexed and feet flat on the bed. And after that, we have to perform first hand hygiene by washing our hands, and I have a video on how to wash our hands properly, and then also don clean gloves. So after washing our hands, we have to don clean gloves, and I have a video on how to put a sterile gloves, or on how to wear a sterile gloves. So since we've already done wearing the clean gloves, we have to cleanse the perineal area with soap and water, so as if that it has water. And then so top, we have to first clean the other side, which is from the top to bottom, and the other side, top to bottom, and top to bottom, and then rinse and dry, so as if that this is the dry cloth. Okay, and after that we are now we have to remove our gloves and perform hand hygiene. So in removing the gloves, you have to do it like this. Like this. Then throw. And perform hand hygiene. So during insertion, we have opened the sterile catheterization. Catheterization kit on a clean bedside. Okay, and put on sterile gloves. Okay, and then put on sterile gloves and drape the patient. So pick the underpad, and ask the patient to raise hips and side of the drape under patient's buttocks. Okay, so here, patient's buttock. And then pick fenestrated drape and place over the perineum with a hole over labia. Like this. So materials preparations. Prepare the antiseptic solution using iodine swab and cotton balls using a sterile forceps. And attach the saline-filled syringe to the side port of the catheter and inflate the balloon. So, here. So, as if that the balloon, so as if that the balloon inflate, and then after that the balloon after deflate the balloon and leave the syringe connected to the port. This, and apply sterile lubricant. So as if that this is a sterile lubricant, apply sterile lubricant to the first 2.5 to 5 centimeter of the catheter tip. Attach the catheter to the drainage system and ensure the drainage bag empty port is clamped. Here. And being to keep the sterile field between the patient's legs. And with non-dominant hand, identify meatus by retracting the labia. Hold this position through the procedure. With the sterile dominant hand, clean the meatus with antiseptic solution, moving from the top to bottom. So allow antiseptic to dry. So, top to bottom, get another one, top to bottom, and at the middle. Ask the patient to bear down with sterile dominant hand. Slowly insert the catheter into the urethra until urine flows. Then, advance the catheter 1 to 2 inches more. Do not force the catheter through the urethra. While inserting, ask the patient to take slow, deep breaths until the initial discomfort has passed. So please take a deep breath. Hold the catheter with non-dominant hand. Use the sterile dominant hand to fully inflate catheter balloon. So materials preparation. Prepare the antiseptic solution using iodine and the swab cotton, and with betadine using a sterile forceps. So we have here. And attach the saline-filled syringe to the side of the port of the catheter and inflate the balloon. So, as if that the balloon inflates here, and then, and after deflate the balloon and leaves the syringe connected to the port. Apply sterile lubricant to the first 2.5 to 5 centimeters or 1 to 2 inches of the catheter tip. Ensure that drainage bag empty port is clamped. Bring the kit to the sterile field between the patient's legs. So as if that this is the sterile lubricant. So lastly, we should not forget to document of the activities or the things we had on our patient. So document the type and size of catheter and balloon, amount of fluid inserted in the balloon, patient's reaction to the procedure, amount and characteristics of urine, name of person performing the insertion, and the time and date it was completed.